let us proceed now with our discussions. Before we go on, do you have any questions with regards sa discussions natin kahapon? Any questions? Meron ba? And I would like to welcome also yung mga bagong pasok dito sa Dynamic Online. Welcome to Equip Review Center. Okay, so let us go to now with number 62. Which procedure should be performed to demonstrate only one sternoclavicular joint with the good morning, with PA projection?
Sir, number 61 po lang tayo, sir.
61?
Yes, sir.
Okay, so sa number 61, tama 61, sorry. Okay, to most effectively demonstrate injured posterior ribs numbers 5 and 6 on the left side, which two projections should be included as part of the series. So in other words, pag ang injured na ribs ay posterior, in other words, the patient should be in supine position. Now, kung ang injured na ribs ay anterior, the patient should be in posterior-anterior or PA projection. Considering that the injured ribs is on the posterior aspect, therefore the patient should be in AP or in supine position. And also the patient, pag ang injured posterior ribs ay on the left side, then the patient should be in LPO position. So when we say LPO again, the patient should be in supine position and the affected side should be close in contact to the tabletop. So kung posterior ribs ang injured, the patient, dalawang projections ang pwede sa kanila. We have the AP projection and the left posterior oblique, or we have the posterior oblique, or that's what we call the AP oblique projection, wherein the affected side should be close in contact to the tabletop. So the answer for number 61, that is Charlie. Next for number 62, as I have said, kung ang i-demonstrate natin ay sternoclavicular joint, only one sternoclavicular joint. Saan nga ulit makikita ang sternoclavicular joint? At the end or medial end of the clavicle. Now, so the medial end or the joint or the articulation which is located in the medial end of the clavicle, that is the sternoclavicular joint. And the joint located in the lateral end of the clavicle, we call that as acromioclavicular joint. So kung isa lang i-demonstrate natin, anong procedure ang piniperform natin? The central ray should be directed 15 degrees medially. So kung ang i-demonstrate natin, I repeat, only one sternoclavicular joint wherein the patient is in prone position, then the central ray should be 15 degrees medially. Naka-angle ang tubo natin. So like for example, this one. Yan. So kung yan ang titingnan natin, that is the PA projection, wherein we are going to demonstrate only one articulation or only one sternoclavicular joint. Next number 63, for the AP projection demonstrating the ribs above the diaphragm, when should respiration be suspended and what effect will that have on the diaphragm? So in other words, kung ang i-demonstrate, mayroon kasi tayong different projections demonstrating the ribs above the diaphragm and demonstrating the ribs below the diaphragm. So magkakaiba ang instructions na binibigay natin sa pasyente kung ang i-demonstrate natin ay above the diaphragm and below the diaphragm, wherein the patient is in supine or in prone position. Dito sa tanong natin, AP projection demonstrating the ribs above the diaphragm, ano ang instructions na binibigay natin sa pasyente? So that is on full inspiration, wherein pag full inspiration ang instruction, the diaphragm will be lowered or depressed the diaphragm. So the instructions, pag above the diaphragm, inspiration ang instruction. So when we instruct the patient to take a deep breath, then the diaphragm will be depressed. No? Magde-depress ang diaphragm. Bababa ang diaphragm. If we are going to demonstrate the diaphragm or rather the ribs below the diaphragm, the instructions given is full expiration. Pag full expiration naman, pag sinabi natin full expiration, labas ang hangin, pigil, yan, tataas naman ang diaphragm doon or the diaphragm or elevate the diaphragm. So pag above the ribs or rather above the ribs above the diaphragm, full inspiration. So the diaphragm now here will depress. So pag below the diaphragm naman na rib cage, ang i-demonstrate natin, the instructions given is full expiration where the diaphragm elevate. Okay, so that is alpha for number 63. Number 64, which projection of the Ferguson method should perform to best evaluate scoliosis? So sa scoliosis, meron tayong method doon na ginagamit. So ano ang tawag ng method na yon? We have the Ferguson method. Pag sinabi natin scoliosis, in other words, that is an abnormal or lateral abnormal curvature of the spine. Right? So pag sinabi natin scoliosis, that is referring to the abnormal or lateral abnormal curvature of the spine. That is scoliosis. So may mga projections tayo or methods na ginagamit to demonstrate the scoliosis. So dito sa tanong, sa method to best evaluate scoliosis, the answer is upright PA projection. Diba dahil pag scoliosis tayo, mayroong scoliosis yung pasyente na ine-x-ray natin normally, mayroon tayong tatlong projections na ginagawa, no, for the evaluation of the scoliosis. What are those three projections? We have the PA upright, we have the PA upright, lateral bending, PA upright, we have the left bending. Or mayroon pa tayong additional na projection, lateral projection. So pag kumukuha tayo ng lateral projection for the demonstration of the scoliosis, kung alin ang may curvature na side, doon ang nakadikit sa vertical cassette holder. Diba yan? So dito muna tayo sa tanong na pag Ferguson method should be performed to best evaluate scoliosis. The answer here is we have the PA upright. Normal yun pag scoliosis. So this PA projection usually used for comparison to distinguish the deforming or the primary curve from the compensatory curve in patients with scoliosis. Yan, PA projection. So that is the example of PA projection. Pero normal, pag nag-PA projection tayo for the demonstration or for the evaluation of the scoliosis, wala tayo, hindi yan tayo naka-collimate, di ba? Open lang yan. Kasi baka nag-collimate tayo pero dito sa book nakalagay collimated. Pero pag scoliosis ang ating ini-evaluate, the central ray should not be collimated. Na hindi ang, rather the tube should not be collimated dahil baka malaki ang curvature, mapuputol lang yung x-ray natin. So that is just an example of the PA upright for the demonstration of the scoliosis, or that is known as Ferguson method. Next, number 65. How many degrees and in which direction should the central ray be directed if it is necessary to have the patient prone for a PAH projection of the sacrum? So sabi nga natin, how many sacral vertebrae do we have? We have 4, or rather 5, diba? Meron tayong 5 sacral vertebrae and fused into one during adulthood, and that is termed as sacrum, diba? So we have 5 sacral vertebrae during infancy, and fused into one during adulthood, and that is termed as sacrum. Yan. So ano lang ang projections na normal na ginagawa natin, pini-perform to demonstrate this sacrum. We have only AP and lateral. Diba? We have AP axial rather and lateral. Yun, AP axial and lateral, yun ang pini-perform natin. Those are the routine projections for the demonstration of the sacrum. So the question here is PA axial. Ano naman ang sagot natin? What is the central ray angulation or the direction of the central ray when the patient is in PA axial? Then the central ray should be 15 degrees caudally. Caudal. Pag PA axial. Pag AP axial, the normal position, the central ray should be 15 degrees cephalad. Kaya titingnan yung tanong, you have to analyze the question dahil simple lang ang question pero sometimes mali ang mga sagot ng mga examinee. So I repeat, for the demonstration of the sacrum in PA axial projection, the central ray should be 15 degrees caudal. For the AP axial demonstration of the sacrum, the central ray is 15 degrees cephalad. So for the lateral projection, for the demonstration of the sacrum, the central ray is just only perpendicular or vertically directed. So that is number 65. How many degrees and in which direction should the central ray be directed for an AP axial projection of the lumbosacral junction and the sacroiliac joints? So I repeat, for the demonstration of the lumbosacral junction, pag sinabi natin lumbosacral junction, ano ang film size na ginagamit ka natin dito? Sa lumbosacral junction, so the film size used here is just 8 by 10. Now, 8 by 10 lang ang ginagamit dahil baka dyan may sasagot na ang film size na ginagamit natin for the demonstration of the lumbosacral junction is 14 by 17 dahil yan ang ginagawa nyo sa hospital. No? So for the demonstration of the lumbosacral junction and sacroiliac joints, it's just 8 by 10 lang ang film size na ginagamit. Dahil junction lang yan. No? Joint lang yan. That is the joint connecting L5 and S1. So usually L5 and S1, yan ang where the what you call, anong pathology nga ang nakikita natin dyan? Anong disease nga? Disc herniation. No? Normally the disc herniation, usually that is located in L5 and S1 in that junction. Lalo na sa mga lalaki. No? So I repeat, for the AP axial projection of the lumbosacral junction and the sacroiliac joints, that is 30 to 35 degrees caudal ang central ray angulation. So 30 to 35 degrees caudal, that is the central ray angulation. Yan. So 30 to 35 degrees caudal. Caudal. AP axial. So for the AP axial, bakit may ganito? For the AP axial, hindi caudal class. That is cephalad. 30 to 35 degrees cephalad for the AP axial projection of the lumbosacral junction. Kung ang pasyente ay lalaki, that is 30 degrees cephalad. Kung ang pasyente ay babae, that is 35 degrees cephalad. So that is for the AP axial projection for the demonstration of the lumbosacral junction. Kung naka-PA axial, kung nakadapa ang pasyente, that is where the central ray should be 30 to 35 degrees caudal when the patient is in PA axial projection. Yan, kung na-PA axial, yan ay 30 to 35 degrees caudal. Yan, so for the AP axial, the central ray is 30 to 35 degrees cephalad, and when the patient is male, 30 degrees cephalad, and when the patient is female, that is 35 degrees sipalan. Okay? Next question, number 67. Which positioning error most likely occurred if the zygapophyseal joints were not well demonstrated and the pedicle was quite posterior on the vertebral body in an image of an AP oblique projection of the lumbar vertebrae. So sa lumbar vertebrae, ano daw ang position? No, most error. Now, which positioning error most likely occurred if the zygapophyseal joints were not well demonstrated and the pedicle was quite posterior on the vertebral body in an image of an AP oblique projection of the lumbar vertebrae. So normally, pag nag-oblique tayo ng lumbar vertebrae, primarily, ano ang dine-demonstrate natin doon? The Scotty dog sign. Diba? Specifically, ano ang tinitingnan natin? The articular processes. Na? Articular processes or in commonly na sinasabi natin, the Scotty dog sign. So the answer here, kung ang pedicle niya ay makikita posterior to the vertebral body in AP oblique, in other words, the patient is rotated too much. No? Too much ang rotation ng pasyente kung ang pedicle ay nasa likod ng vertebral body in an AP oblique projection. Pero kung ang pedicle ay makikita posterior or when the pedicle is located anterior to the vertebral body, in other words, ano naman ang kulang doon? The patient is not rotated enough. Diba? Kaya normally, kung nagde-demonstrate tayo ng zygapophyseal joints in the AP oblique projection of the lumbar, the body should be rotated by 30 to 60 degrees ang body rotation natin. So I repeat, kung nagde-demonstrate, kung ang i-demonstrate natin ay zygapophyseal joints of the lumbar vertebrae, then the body should be rotated between 30 to 60 degrees body rotation. So I repeat, kung nakikita natin ang pedicle posterior to the vertebral body, ano ang naging error dito sa AP oblique ng lumbar vertebrae? The patient is rotated too much. Sobra ang rotation. Pero kung ang pedicle ay makikita natin sa AP oblique ng lumbar, excuse me, the pedicle is located anterior to the vertebral body. In other words, the patient is not rotated enough. Hindi nakarotate ng tama. So for the demonstration of zygapophyseal joints and the lumbar vertebrae, I repeat, the body should be rotated between 30 to 60 degrees body rotation. And so what is the other name for zygapophyseal joint? That is known as, anong ang other name ng zygapophyseal joint? Diba? Pag sinabi nating zygapophyseal, that is also known as apophyseal joints. Okay? Question? Next number 68. How many degree and in which direction should the central ray be directed for the lateral projection of the lumbar vertebrae when the vertebral column is not parallel to the table? So how many degrees and in which direction should the central ray be directed for the lateral projection of the lumbar vertebrae when the vertebral body is not parallel with the tabletop? So sa lateral projection sa lumbar vertebrae, meron tayong tatlong projections dyan, di ba? So first we have the AP axial projection, we have the AP projection, we have the AP oblique, and we have the lateral. So sa lateral projection, the central ray, kung hindi nakaparallel ang vertebral column with the tabletop, then we have to angle the tube. Ilang degrees ang angulation? 5 to 8 degrees. How that? So the central ray angulation, excuse me. Okay, so for the when the lumbar vertebrae, I repeat, or when the vertebral column is not parallel with the tabletop in the lateral projection, then the central ray should be angled by 5 to 8 degrees caudally. Kung ang pasyente ay lalaki, 5 degrees caudally. Kung ang pasyente ay babae, 8 degrees caudally ang central ray angulation. So like for example, this position. No? So itong nasa left side natin dyan sa monitor nyo, yung nasa left side, that is where there is a lead rubber which is placed under. No? Under dito sa may lower end of the ribs. No? So kung makikita mo, no, may lead rubber. Kung mayroong lead rubber, therefore the central ray should be perpendicular. Diba tayo, pag nag-x-ray tayo sa hospital, hindi natin yan tinitingnan. Diba? Hindi tayo nagtitingin kung maglalagay ba tayo ng lead rubber under the floating ribs or the rib cage area. At hindi rin tayo naglalagay ng sponge dito sa between the knees. Bakit tayo naglalagay niyan? Para walang movement, na? Para hindi nakarotate ang katawan ng pasyente. So bakit tayo maglalagay niyan? Para parallel ang vertebral column with the tabletop. Normally, lalo na sa lalaki dahil mas broad ang shoulder ng lalaki. Kaya kailangan nakaangat, no, ang shoulder. So kung nakaangat ang shoulder, kung makikita natin horizontal or rather parallel ang vertebral column in line with the tabletop, then the central ray should be perpendicular or vertically directed. So kung makikita mo dito sa right image ng screen nyo, yan, walang lead rubber na nakalagay, that is the time that you have to angle that tube para ma-compensate, na? Angle that tube by 5 to 8 degrees caudally. Yan ang sinasabi nga natin, kung ang pasyente ay lalaki, then that is 5 degrees caudal. Kung ang pasyente ay babae, that is 8 degrees caudally. So that is the central ray angulation. Okay, next. Which of the following would improve visualization and the spinal processes and the overall image quality on the lateral projection of the thoracic vertebrae? And so which of the following would improve visualization in the spinal processes and overall image quality on the lateral projection of the thoracic vertebrae? So sabi nga natin, sa thoracic vertebrae, how many thoracic vertebrae do we have? We have 12 thoracic vertebrae. So pag sinabi natin thoracic vertebrae, that is also known as, anong ang tawag natin dito? The other term, that is also known as the, may term natin tayo dyan, nakalimutan ko lang, later on, no, maiaalala ko. And how many dorsal, rather? So minsan may mga questions na pag sinabing how many dorsal vertebrae do we have, ang sagot natin, we have only 12 dorsal vertebrae. Kung ang tanong sa board exam, tinanong how many dorsal vertebrae, ang sagot natin, that is only referring to thoracic vertebrae. So we have only 12 dorsal vertebrae. Hindi natin isasagot yung 33 or hindi natin isasagot yung 26. No, dahil baka isipin natin pag sinabing dorsal vertebrae, that includes 5 cervical, 12 thoracic, 5 lumbar vertebrae, and we have 5 sacral, and we have 4 coccygeal. Na? Baka yun ang isagot natin, hindi. Kaya pag sinabing how many dorsal vertebrae do we have, our answer is only 12 dorsal because that is just referring to thoracic vertebrae. So anong instructions natin in order to improve the visualization of the spinal process in the lateral projection of the thoracic vertebrae? So we have to use breathing technique. Na? So breathing technique ang instructions natin dito. So pag sinabi nating breathing technique, that is just referring to slow breathing or quiet breathing. Yan. So yan ang projections natin na ginagamitan natin. One of the projections in which we are using the breathing technique. So isa yan ang ginagamitan ng breathing technique. So pag sinabi nating breathing technique, it is just only a slow breathing or quiet breathing. So gagamit din tayo ng low MA with a long exposure time. Yan, so breathing technique. Isa sa mga projections na ginagamitan ng breathing technique, that is lateral projection of the thoracic vertebrae. Or ito din ang ginagamitan natin ng anode hill effect. Diba? Kung maalala nyo sa discussions nyo, sa anode hill effect, dahil when we define anode hill effect, we define as the intensity of radiation and the cathode side is higher than the anode side. So I repeat, itong projection na ito, lateral projection and AP projection of the thoracic vertebrae, yan ang ginagamitan natin. Ito ang mayroong anode hill effect. No? Ito yung mayroong hill effect. Dahil kung i-define natin ang anode hill effect, I repeat, that is defined as the intensity of radiation in the cathode side is higher than the anode side. So paano yun, sir, pag nagkabaliktad, no? Kung ang cathode side ay nakafocus doon sa thinner side, thinner. Ibig sabihin, kung ang cathode natin ay nakafocus doon sa manipis na area, paglabas ng image, syempre maitim. No? Kung ang cathode side nasa thinner area. So kung ang anode side nasa thicker area, in other words, mas lighter naman ang labas, ang outcome ng X-ray field. So that is the lateral projection of the thoracic vertebrae. So this is like for example, ito na. Bakit kailangan, sir, ang breathing technique? Bakit kailangan ang instructions na binibigay natin ay slow breathing or quiet breathing? In order to obliterate or to diffuse the vascular markings and the ribs or at the end of expiration. Rather, I repeat, bakit kailangan breathing technique, quiet breathing or slow breathing? In order to obliterate or diffuse the vascular markings. So yan, vascular marking. Yan ang reason, no, bakit kailangan pinahihinga natin ng malalim. Or rather, pinahihinga ang pasyente during AP and the lateral projection of the thoracic vertebrae. Yan, to obliterate or diffuse the vascular markings. Yan. So kung makikita nyo, class, dito sa image na ito. Ha? So the same process. Kung mag-x-ray tayo ng thoracic vertebrae, lateral, we have to put a lead rubber under the rib cage, no, dito sa may lower end of the ribs. No, so kung mayroon tayo ulit, lead rubber, the central ray is just only perpendicular. Pero kung walang rubber tayong lead rubber na ginamit, so this time we have to angle the tube towards or cephalad. Ilang degrees? That is 10 to 15 degrees. 10 to 15 degrees central ray angulation kung walang lead rubber tayong ginagamit. So 10 degrees cephalad for most female and 15 degrees cephalad for male patient. For the thoracic, lateral projection and the demonstration of the thoracic vertebrae. Yeah, so that is lateral projection. Do you have questions? Yung iba siguro tulog pa, class, no? O kaya lasing kagabi, hindi pa pumasok. So more than 50 yung wala today, no? Yan. So do not presume na kabisado nyo na lahat. Siyempre, marami hindi pa kabisado yan. No? So, yung mga results sa exams nyo, o marami din ang hindi pa nagsasubmit ng mga answers nyo doon sa Google form. Kung ngayon kayo magsasubmit, alam mo na yung sagot, na daya mo na. No? So, dapat sinubmit nyo kagabi or kahapon yung result o yung answer ng exams nyo. Kaya nga, class, sabi ko nga, we advise that you have to take all the exams given during online review or during online and face-to-face. So whether you like it or not, dapat mag-exam kayo. No? Do not presume na alam mo na lahat ang sinasabi namin. Dahil kung alam mo na, bakit ka pa nag-review? Sana hindi na lang. Diba? Alam mo naman pala na. Yan, so marami ang wala, lasing. Ako nga, class, lasing kagabi, pero nandito ako ngayon. No, because we are obligated, no, we are obliged to wake up. and to give lecture. And also on your part, you have also obligation, no, to wake up and to learn because the board exam is nearly approaching. Pakialam mo, sir. Kami naman magbo-board. Siya nga naman, diba? Okay, next number. Which evaluation criterion pertains to the AP projection of the cervical vertebrae? So AP projection such as the what we call FATCH method. So pag sinabi nating FATCH method for the cervical vertebrae, this is just for the demonstration of C1 and C2. Na? Meron tayong mga methods na ginagamit to demonstrate C1 and C2. Ano nga ulit yon? Yung mga methods na yon? We have the AP FATCH method. We have the PA-JAD method. We have the AP open mouth. And we have the Kasabak method. So yan ang mga methods na ginagamit natin to demonstrate specifically C1 and C2. So what is the other term for C1? That is atlas. And the other term for C2, that is axis. Or ano pang other term ng C2 aside from axis? We have the, ano nga ulit dyan? Natandaan nyo, class? Sige nga. Other term ng C2 aside from axis? Class. Buhay pa. Yan. So ang other term, ang tawag doon ay epistropeios. No? Epistropeios, that is the other term or the other term for axis or for C2. And epistropeios. Okay. So I repeat one of the AP projection for the demonstration of the cervical vertebrae, specifically the C1 and C2, yung method na yan, that is FATCH method. So in FATCH method, that is where the patient is in supine position. Yan. So in FATCH method, that is where the patient is in supine position, then hyperextend the chin. So makikita mo na ang dens or the entire dens or odontoid process can be seen within the foramen magnum. So for number 70, the answer is delta. So in other words, the C2 or the entire odontoid process or the dens of the odontoid process can be seen within the foramen magnum. So yan, yung position na yan, that is FATCH method. I repeat that the head should be hyperextended. And ano ang dine-demonstrate ng FATCH method? C2 lang. Diba, class? C2 lang ang dine-demonstrate ng FATCH method, specifically the dense odontoid process. Na? So yan, ang dense odontoid process in FATCH method and PA-JAD method can be seen within the foramen magnum. So I repeat, ang JAD method, naka-PA yan, ang pasyente, and the head should be hyperextended. So pareho nakikita sa within the foramen magnum during PA-JAD method or during AP FATCH method. Yan. So but never attempt to do this position if there is a fracture or suspected fracture or degenerative disease and the upper cervical region. So the upper cervical region, yan. So kung makikita mo or mayroong suspected fracture and the upper cervical region or mayroong degenerative disease. Pag sinabi nating degenerative disease, in other words, mayroong tawag doon, mayroong sakit ng matatanda, no? Yung gout or mayroong what do you call this? Ano nga ulit, class? Yung gout or ngayon, arthritis, yan. So when there is an arthritis, pag sinabi nating degenerative disease, yun ang sakit ng pangmatanda. No? Ano yung example na sakit? Yan yung mayroong arthritis. No? So never attempt to do this position. So this can only be done during there is no fracture or other degenerative disease, specifically NC2. Yan. So that is FATCH method. Next number, which projection of the knee can be accomplished? Which projection of the knee can be accomplished with the patient upright, the affected knee flexed, and each anterior surface surface in contact with a vertically placed image receptor and horizontally directed the central ray entering the posterior aspect of the knee. So posterior aspect of the knee. So the answer, anong method ito? Na ang pasyente ay nakatayo facing, nakatayo where its anterior surface of the knee ay against the image receptor or vertically direct image receptor, and the central ray is horizontally directed wherein the X-ray beam enter in the posterior aspect of the knee. Anong method ito? Ang tawag ng method dito ay nandito ba? Rosenberg method. So that is known as Rosenberg method. So pag knee and horizontally directed, so that is PA projection with bearing method. So pag sinabi nating PA projection with bearing method, pag sinabi nating with bearing, in other words, the patient should be in upright position. With bearing method, in other words, the patient should be in upright position. So kung makikita natin dito sa left side, ito yung question wherein the patient is facing the vertical cassette holder and flex the knees. So ang central ray dito ay horizontally directed and the X-ray beam enters in the posterior aspect of the knee. So Rosenberg method yan, PA with bearing projection. So minsan dito sa right image naman natin, sa right image kumukuha din tayo dyan. Pag ang pasyente ay nakatayo, ibig sabihin weight bearing method ang tawag doon. So laging tatandaan, pag mayroong question na ang sagot ay weight bearing, the patient is always in upright position. So dito sa right image natin, pag kumuha tayo, minsan kumukuha tayo dito pag nakatayo ang pasyente. Sa mga elderly patient tayo dyan, di ba nag-x-ray, especially kung mayroong mga arthritis ang pasyente. But we have to angle the tube. Ilang degrees nga ang angulation pag nag-AP projection tayo? Both in upright and in recumbent position of the knee. Pag upright and recumbent position of the knee, ilang degrees nga nag-a-angle ba tayo sa knee? Siyempre, nag-a-angle tayo. Whether it is upright or in recumbent position. Ilang degrees? 5 to 7 degrees sipalan. 5 to 7 degrees. So sa libro, magkakaiba yung mga bagong edisyon ng libro ngayon. May mga angulations tayo, kung ang measurement ay 19 to 21 or 19 to 20 or below 20, then above 21, magkakaiba, So dito yung gagamitin muna natin na central ray angulation. Dito pag nakasani, AP upright or AP recumbent and lateral, that is 5 to 7 degrees sipalan ang central ray angulations. So the detailed discussions will be done during your face-to-face. Okay, next question. For the lateral projection of the patella, which positioning maneuver reduces the femoropatellar joint space? So in other words, pag sinabi nating patella, that is referring to the largest sesamoid bone of the body. So pag sinabi nating patella, that is the largest sesamoid bone of the body, which is located on top of the knee joint. Diba? Saan nga ulit yung apex ng patella? Nasa itaas ba o nasa ibaba? Apex ng patella. Saan ang apex? Pababa, di ba? So, yan. Very good.
Bottom, yes.
So, sa baba. Pag sinabi nating apex, in other words, that is referring to the pointed area. Pointed area. Ang apex of the patella, I repeat, yun ang makikita sa ibaba. Yung pointed area, that is the patella. Magkaiba yan ng apex ng lungs. Dahil yung apex ng lungs, yung pointed area nasa itaas naman. Kaya ang apex ng lungs ay nasa itaas. So ang patella nasa ibaba. So the answer here is flex the knee more than 10 degrees to reduce the femoropatellar joint space. Pero in the lateral projection of the patella, normally, the knee flexion should not be more than 5 to 10 degrees. Diba? Pag naglateral tayo, sa lateral projection of the patella, the flexion of the knee should not be more than 10 degrees. So it is just between 5 to 10 degree flexion in the normal lateral projection of the patella. Bakit hindi more than 10 degrees? In order to prevent, no? Para ma-prevent yung that will cause fracture, no? More fracture of the patella. Kaya lang dito ang tanong to reduce, no? To reduce the femoropatellar joint space, yan, we have to flex the knee by more than 10 degrees. So wag malilito ha. Wag malilito dito sa lateral projection of the patella. Normally, ang degree flexion ay not more than 5 to 10. But the question here is to reduce the femoropatellar joint space. The flexion should be more than 10 degrees. So magkaiba ang flexion ng lateral projection of the patella and lateral projection of the knee. Dahil sa lateral projection of the knee, the flexion of the knee should be 30 to 35 degree flexion. So magkaiba yan, class, ha? Ang lateral projection for the knee, the degree flexion is 30 to 35 degrees. For the lateral projection of the patella should not be more than 10 degrees. It is just between 5 to 10 degrees. But if you are going to reduce the femoropatellar joint space, the degree of flexion is more than 10 degrees. And in other words, increase the flexion if you want to reduce the joint space. Okay, next question. Which projection of the ankle should be performed to best demonstrate the ligamentous tear? Yan. So sa ankle natin, paano nga nabuo ulit, class, ang ankle joint? Paano nabuo ang ankle joint? So the ankle joint is formed by 3 bones. Diba? Ankle joint is formed by 3 bones. We have the distal end of the fibula, the distal end of the tibia, and the proximal end of the proximal end ng tibia, fibula. Ano nga ulit yun, class? Proximal end ng bones of the ankle, which is the talus. Tama nga ba? Hindi. Talus or astragalus? Yan, talus pala. Yan. So I repeat, the ankle joint is formed by the 3 bones, the proximal end of the talus, the distal end. Tama ba ako, class? Talus, heel bone, ano ba yung heel?
Yes po.
Yan. Proximal end of the talus, distal end of the tibia, and the distal end of the fibula. Yan. So dito sa projection, which is used to demonstrate the ligamentous tear, our answer here is AP projection with inversion. Ito yung tinatawag natin na stress method. Stress method that is used to demonstrate the ligament tear or rupture. To demonstrate the ligament tear or rupture or ligamentous tear, yan, AP projection with inversion or AP projection with wherein the ankle is rotated inward, or that is what we call the stress method. But when injury is recent, kung bago lang ang injury, and the ankle is acutely sensitive to movement. Yan, syempre, pag bago lang ang injury, masakit nga naman yan. Pero sino ang gumagawa nito ng stress method? Radiologist, no? Yung doctor, siya lang ang nagpe-perform nito. So this is AP stress method, no? And that is the projection for the demonstration of the ligamentous tear. Yan, or the ligament tear or rupture. Yan, so kung makikita dito sa right image, yan ang tinitingnan natin. So dyan ang nagkakaroon ng rupture ng ligament. No, it is between or in the side or below the end of the fibula. No, that is the end of the fibula, and that is the side portion of the talus or the astragalus. And okay, next question. Where should the central ray enter for the lateral projection of the ankle? Yan, sa lateral projection of the ankle, meron tayong dalawang klaseng lateral projection. Isang lateral projection wherein the reference point is at the medial malleolus. No? Pero kung ang ankle naman natin sa ganitong position, that is where the reference point is medial malleolus. So that is the normal lateral projection of the ankle. So mayroon din tayong lateral projection wherein the medial side of the foot is close in contact with the tabletop. Yan. Ang reference point naman natin dyan, that is lateral malleolus naman. Next question. All of the following projections can be used to image a patient with a suspected intertrochanteric fracture. Exact. So lahat daw ito ay ginagamit to demonstrate the intra or intertrochanteric fracture. Meron ditong isa na hindi ginagamit. Ha? So what is the answer here? That is, tama ba? Parang mali. 26 ang ibang binabasa ko. Ano ba yan? Tanga. So what is number 75 pala tayo, no? What is the appropriate collimated field size for an AP projection of the foot? So the appropriated collimated side, that is 1 inch of all sides and 1 inch beyond the calcaneus and the distal tips of the toes. So yan, that is the appropriate, no? Collimated side for the AP projection of the foot. Akalain mo yan, di ba? Pati collimation yan tinanong ng examiner. So pag sinabi nating 1 inch, that is equivalent to 2.5 cm on all sides and 1 inch beyond the calcaneus and the distal tips of the toes. So that is the collimation and the AP projection of the foot. So sa AP projection of the foot, meron tayong dalawang klase, di ba? Sa AP projection. Normally, kung ang i-demonstrate natin is the entire foot. Pag sinabi nating entire foot, that is from phalanges, the metatarsals, and all the tarsal bones. That is where we angle the tube by 10 to 15 degrees cephalad. Diba? So sa AP projection of the foot, if we are going to demonstrate the entire foot, pag sinabi nating entire foot, that is from phalanges, metatarsals, and bones of the tarsals, then the central ray is angled by 10 to 25 or 10 to 15 degrees cephalad. Ano na ang tawag doon? That is AP axial projection of the foot pag naka-angle ng 10 degrees or more. Pero kung ang i-demonstrate natin AP projection of the foot, ang i-demonstrate, ang niro-rule out lang ay phalanges and metatarsals, then the central ray is just only perpendicular or vertically directed. Okay, so that is number 75. Next, number 76. All of the following projections can be used to image a patient with a suspected intertrochanteric fracture. Exact. So lahat daw dito ay ginagamit to demonstrate a suspected intertrochanteric fracture or kung may fracture sa hip bone. Diba? So anong projection ang ginagamit natin? AP projection of the hip. Diba? Hindi pwedeng galawin. Tama. Na? AP projection of the pelvis. Dahil kung ang AP projection of the pelvis, that includes the hip joint. Diba sa isang 14 by 17 crosswise, kung ang request ay hip joint, using 14 by 17, include the pelvic bones. Diba kung AP projection of the pelvis, 14 by 17 crosswise, include the hip joint. And another projection, we have the ixo-lateral projection, or what we call the Nilus-Miller method of the hip. Ito yung mga projections natin na ginagamit, no, to demonstrate when there is a suspected fracture in the intertrochanteric area. Ano lang hindi pwede? That is the lateral projection or the Lowenstein method of the hip. Pag sinabi nating class Lowenstein method, that is the lateral projection of the hip. Wala lang ako ditong image. Lateral projection of the hip, single hip joint fracture. So in other words, ang Lowenstein method, naka-frog leg ang pasyente unilaterally. Ha? So, ibig sabihin sa Lowenstein method, ang pasyente dyan ay naka-frog leg unilaterally. Yung isa lang na hip joint ang naka-frog leg. So, sabi nga natin, kung mayroong suspected fracture of the hip joint, yan, hip bone, hindi po pwedeng galawin ang pasyente. So, ito lang ang sagot. So, ang Lowenstein method, that is a unilateral frog leg of the hip joint wherein the central ray is perpendicular or vertically directed. Ayan. Okay, so that is Charlie. Next number 77. Which of the following will best demonstrate suspected fractures of the acetabulum? So suspected fractures of the acetabulum, laging tatandaan, di ba? Yan, yung Bridgman method, anong dine-demonstrate natin dyan? That is pelvic inlet. Ang Taylor method, anong dine-demonstrate natin? That is pelvic outlet. Ang Juday method, ano ang dine-demonstrate? When there is a fracture of the acetabulum. Ang exolateral projection or Danilos-Miller method, anong dine-demonstrate? When there is a suspected fracture of the hip or when there is a suspected fracture in the intertrochanteric area. Yan. So, when there is a suspected fractures of the acetabulum, the answer here, we have the Juday method or the AP oblique projection of the acetabulum. So, I have here the different projections, no? Yan. So, kung ang i-demonstrate natin ang yan, so for the Bridgman method, ang Bridgman method natin, itong nasa left na, yung nasa left, that is a Bridgman method. No, itong nasa upper. So Bridgman method wherein the central ray is 40 degrees caudally. Yan. Yung dito naman sa baba, sa left, no? Sa left portion of your monitor, yung nasa baba, that is the Taylor method naman, yung nasa baba. The same central ray angulation. So itong nasa itaas naman na dalawa, that is the AP oblique projection. No? AP oblique projection, or that is the Juday method. So the Juday method for the demonstration of fracture of the acetabulum, yan. Mayroon kasi tayo sa Juday method, mayroon tayong dalawang oblique, AP oblique projection. Sa Juday method, generally, pag sinabing fracture, to demonstrate the fracture of the acetabulum, ang method natin dito, kung method ang tanong, the answer is Juday method. Kung projection ang tanong, to demonstrate fracture of the acetabulum, ang sagot natin ay AP oblique projection. Tandaan ha, dahil bago ang examiner dito sa radiographic procedures and techniques. Kung ang tanong ay method ang sagot. Kung ang tanong ay projection ang sagot. O halimbawa, ano ang nagde-demonstrate ng fracture? What projection demonstrating the fracture of the acetabulum? That is AP oblique projection. For the demonstration of fracture of the acetabulum, anong method? Juday method yan. Yan. So sabi ko nga kanina, mayroon tayong dalawang oblique dito sa Juday method. So isang oblique projection wherein the area of interest is close in contact to the tabletop. Yan. Kung ang area of interest is close in contact to the tabletop, anong position yan? That is RPO position. So RPO yan. When the affected area or when the area of interest yan ay elevated dito sa acetabulum, yan, the unaffected side naman is close in contact to the tabletop. So the unaffected side is close in contact, or when the affected side up, that is LPO naman. So dalawang obliques yan. No? Sa baba naman, that is the image of the Danilos-Miller. No? Image of the Danilos-Miller, that is where the unaffected side is elevated and the affected side is alongside of the table. Yan, ang cassette natin dito sa Danilo's Miller should be faced against the hip joint, no, on the lateral side of the hip joint. So kung makikita mo. Yan. Next, question number 78. What specific portion of the acetabulum is demonstrated by the AP oblique projection, external oblique position? Yan. Ito yung na-discuss natin kanina, no? In AP oblique projection, under Jode approach or Jode method, kung external oblique, anong dinidemonstrate natin? External oblique, yan, posterior rim ang dinidemonstrate natin. So in other words, kung posterior rim ang dinidemonstrate natin ay naka-AP oblique projection and the acetabulum, in other words, the affected side is close in contact to the tabletop. Kung external oblique yan. Kung internal oblique, no? Internal oblique, ano ang dinidemonstrate natin? Anterior rim. So kung anterior rim ang dinidemonstrate natin, the affected side is elevated or the affected side up. Na? So I repeat, sa AP oblique, dalawa ang oblique natin for the demonstration of fracture of the acetabulum. Pag AP oblique, or that is what we call the external oblique, the affected side is close in contact or the affected side down. So external oblique, posterior rim ang dinidemonstrate natin. Pag internal oblique, anterior rim ang dinidemonstrate natin. Next number, when performing a lateral projection of the scapula, lateral projection of the scapula. So pag nagde-demonstrate tayo ng lateral projection of the scapula with the patient positioned right anterior oblique or RAO or left anterior oblique or LAO, approximately how many body rotation is necessary for the average patient? So pag nagde-demonstrate tayo ng lateral projection of the scapula, ang lateral projection natin sa scapula, it could either be the patient is in RAO or in LAO position. So ilang degrees ang body rotation? So that is 45 to 60 degrees body rotation. So yan, that is the body rotation if we are going to demonstrate the scapula in the lateral projection. So ang lateral projection ng scapula, the patient could either be in RAO or in LAO. Sabi natin kahapon, pag sinabing RAO or LAO, that is also known as anterior oblique or that is also known as PA oblique. Yan. So that is the example. No? Yan ang example natin. So kung makikita nyo class yung image dito sa left side of your screen, and that is the image or that position is used for the delineation or for the demonstration of the acromion and the coracoid process of the scapula. So kung ang i-demonstrate natin ay ang acromion and coracoid process of the scapula, in other words, we have to flex the elbow and place the back of the hand on the posterior thorax. So sa position na yan. So ang position na yan, that is RAO. Ano ang dinidemonstrate natin dyan? That is acromion and coracoid process of the scapula. And the reference point here in this position is the medial border of the scapula. So kung ano yung prominent side, no? Yung prominent area in the medial border of the scapula, that is the reference point in demonstration or in the lateral projection of the scapula for the demonstration or for the delineation of the acromion and the coracoid process of the scapula. Dito naman sa side naman, sa right side of the right image in your monitor, that is the AP projection of the scapula. If you are going to demonstrate the body of the scapula on the right image, yan, sa right image, body of the scapula, therefore you have to raise your arm. So yan, nakaganyan yung position. So in the scapula examination, this is also one projection, one of the projections wherein a breathing technique is used. So sa AP projection ng scapula, isa din ito sa mga projections na ginagamitan natin ng breathing technique. Breathing technique, in other words, slow breathing or quiet breathing. So dalawa na ang ginamitan natin, di ba? Or dalawa na ang ginamitan natin ng breathing technique. Ano yung isa kanina? Lateral projection of the thoracic vertebrae. At ano yung isa ngayon? We have the AP projection of the scapula. Yan ang mga ginamitan natin. Meron pa tayong madadaanan mamaya na mga ginagamitan natin ng breathing technique. Ano ang purpose natin dito? In order to obliterate or in order to diffuse the vascular markings. So yan ang purpose natin, na sa lateral projection of the thoracic vertebrae, AP projection of the scapula. Yan, ginagamitan natin ng breathing technique. It's either slow breathing or quiet breathing in order to diffuse or in order to obliterate the vascular markings. Next number, with reference to the plane of the image receptor, how should the humeral epicondyles be positioned for the AP projection of the shoulder with the shoulder in internal rotation? Yan, with reference to the, I repeat, with reference to the plane of the image receptor, how should the humeral epicondyles be positioned for the AP projection of the shoulder with the, wherein the shoulder is an internal rotation? So mayroon tayong routine projections of the shoulder, no? Mayroon tayong routine projection ng shoulder. Ano yung routine natin? We have the AP neutral, the AP internal rotation, and the AP external rotation. And AP internal and AP external rotation. So ang tanong dito, sa AP with internal rotation of the shoulder, ano ang position ng humeral epicondyles? The humeral epicondyles is perpendicular in relation to the image receptor. Yan. Kung ang pasyente, ang shoulder ay nakarotate externally, ano ang position ng humeral epicondyles? The humeral epicondyles are parallel in relation to the image receptor. Kung ang pasyente naman ay naka-neutral in position sa shoulder, the epicondyles should be in oblique position. So yan ang mga position ng humeral epicondyles. Kung ang X-ray of the shoulder, kung naka-AP internal rotation of the shoulder, ano ang position ng humeral epicondyles? Perpendicular in relation to the field or in relation to the image receptor. Kung ang pasyente, examination of the shoulder, AP projection with external rotation, ano ang position ng humeral epicondyles? Parallel naman in relation to the field or in relation to the image receptor. Kung ang pasyente ay AP projection of the shoulder, wherein there is no rotation, not external or not internal rotation, it is just neutral or normal position. Ano ang position ng humeral epicondyles? The humeral epicondyles is in oblique position. Pag sinabi nating oblique position, normally, that is where the body is rotated 45 degrees. Diba? Kaya 45 degrees ang humeral epicondyles and AP neutral projection of the shoulder. 45 degrees dahil naka-oblique ang humeral epicondyles. Okay, do you have questions, class? Questions? Okay, break muna tayo, class. Break muna bago tayo mag-proceed. Let's take a break first. Thank you. Class will resume after 10 minutes. It is now 10:15. Yan, 10:15. Or resume tayo ng 10:30 class. 15-minute break. Thank you. Okay, let us resume again. Do you have any questions sa mga discussions natin? Any questions? Okay, let us go to now with number 81. Which projection of the upper limb should be performed to demonstrate a fracture of the proximal humerus when the arm cannot be abducted? So normally, pag mayroong fracture of the proximal humerus, iisa lang lagi ang nasa isip natin na nasagot. That is transthoracic lateral, or that is known as Lorentz method. I repeat, for the demonstration of a fracture in the proximal end of the humerus and the arm cannot be abducted, so the answer is transthoracic lateral or Lorentz method. So this is the example that is the transthoracic lateral. In nasa left image natin, nasa left image, yan, sa monitor nyo, that is the transthoracic lateral, wherein the affected side is close in contact to the vertical cassette holder, and the unaffected, or rather the affected arm should be depressed, and the unaffected arm should be placed on top of the head. Yan. So kung mayroong trauma or when the trauma exists, I repeat, that is transthoracic lateral. Yan, transthoracic lateral, wherein the affected side is close in contact to the vertical cassette holder. If the unaffected shoulder cannot elevate, therefore we have to angle the tube. Huh? So dito sa transthoracic lateral, kaya horizontally directed, the tube is not angulated dahil po pwede namang iangat, no, yung unaffected side at ma-depressed ang affected side. So kung hindi kayang iangat ang unaffected, diretso lang, that is the time that we have to angle the tube by 10 to 15 degrees sipalad. Yeah? So I repeat, in the transthoracic lateral or in the Lorentz method, when the unaffected side cannot be elevated at hindi maiangat, that is the time that we have to angle the tube by 10 to 15 degrees sipalad. But normally, in transthoracic lateral or in Lorentz method, that is where the central ray is horizontally directed. And so dito sa position na ito, ginagamitan din natin dito class ng breathing technique, no? In order to obliterate or diffuse the vascular markings. So we use here also a breathing technique. Quiet breathing or continuous breathing or slow breathing. Yan. So tatlo na, no, ang ginamitan natin ng breathing technique. Isa ay ang AP projection of the scapula, isa ay ang lateral projection of the thoracic vertebrae, at isa ay ang projection ng transthoracic lateral. Yan ang mga ginagamitan natin. Mayroon pa tayong ibang projections na ginagamitan ng breathing technique in order to obliterate or in order to diffuse the vascular markings. Yeah. So that is transthoracic lateral or Lorentz method. Itong nasa right image nyo naman sa monitor, yan ay ang Fisk method. So mayroon din tayong dalawang klase, no, na ginagamit dito sa Fisk method in order to demonstrate, or rather, Fisk method, ano ang dine-demonstrate natin? The intertubercular groove. The intertubercular groove, yan ang dine-demonstrate natin sa Fisk method. So dito sa Fisk method, mayroon tayong dalawang projections dyan or dalawang position. Itong dito sa monitor nyo, that is where the patient is in supine position and the cassette must be placed on top of the shoulder. At ang isang Fisk method naman, that is where the patient is in erect position. Yan, hawak naman niya ang cassette. Tingnan ko kung meron ako dito. Wala. So yan, that is the Fisk method. That is where the patient is in supine position and for the demonstration of the intertubercular groove. Okay, next number, what would be the required patient position to demonstrate the left shoulder using the AP oblique projection or Grassi method? So sabi nga natin, ano ba ang dine-demonstrate natin sa Grassi method? ang dinedemonstrate natin sa Grassi method, it could either be Grassi method, could either be AP oblique, or could either be RPO or LPO. So glenoid cavity ang dinedemonstrate natin dito sa Grassi method. So I repeat, in Grassi method, the patient possession is an oblique AP oblique projection. So pag sinabi nating AP oblique, it's either RPO or LPO. Ano ang dinedemonstrate natin sa Grassi method? That is glenoid cavity. No, glenoid cavity wherein the body is rotated by 35 to 45 degrees. 35 to 45 degrees ang body rotation. Common ito na tinatanong sa board exam lagi, ang Grassi method, to demonstrate the glenoid cavity. So this is the radiograph na. So that is for the demonstration, or that is Grassi method, wherein the patient is rotated towards the affected site. So ang Grassi method, po pwedeng naka-recumbent ang pasyente or po pwedeng naka-upright ang pasyente. So dito sa itaas na picture on the left side, when the patient is in recumbent position, therefore the body is rotated by 45 degrees or even more than 45 degrees ang body rotation. So in the AP upright, the body rotation is just between 35 to 45 degrees body rotation in order to demonstrate the glenoid cavity, no? To demonstrate the glenoid cavity. So kung makikita mo dito sa right image natin, no? Yan, glenoid cavity. Okay, so that is Grassi method or AP oblique projection. Okay, next question. When demonstrating the intertubercular groove with the Fisk modification of the tangential projection, how should the affected humerus be positioned? Plus, pag sinabi nating tangential projection, in other words, the body part being x-rayed is the one, yan ang ginagalaw natin, is the one being angled. No? So pag sinabi nating tangential projection, the body part is being angled. Pag sinabi natin axial, in other words, the central ray angulation is 10 degrees or more. No? So in other words, pag sinabi nating word na axial, there is a longitudinal angulation of the central ray by 10 degrees or more. Pag sinabi nating tangential, in other words, the body part is being angled. Dito sa tanong, to demonstrate the intertubercular groove in Fisk modification of the tangential projection, how should the affected humerus be positioned? So the affected humerus is angled by 10 to 15 degrees from the vertical position. Like for example, this one. Ito yung sinasabi natin kanina, no? Sabi ko, na dalawang klase ang Fisk method. Isang klase kanina wherein the patient is recumbent, wherein the cassette must be placed on top of the shoulder, yan, to demonstrate the intertubercular groove. Ito naman ang isang position, a tangential projection also, wherein the patient is in erect or upright position. Yan, ang cassette hawak ng pasyente and the central ray is just perpendicular. No? So yan. Instruct the patient to lean forward or backward. Yan. So ang 10 to 15 degrees posterior to the long axis of the humerus, depende yun, ano? Depende sa pasyente, no, kung kayang i-position ng pasyente. Halimbawa, like for example, this one, we instruct the patient to lean forward para ang humerus ay 10 to 15 degrees in relation to the field or naka-angle ang humerus. So that is one of the position or projection demonstrating the intertubercular groove. Next question, one way that the lateral radiograph of the humerus produced with the patient in the lateral decubitus position and the image receptor is placed between the arm and thorax appears different from the lateral position with the patient standing is that the former demonstrates. Yon, ibig sabihin class, ito yung when the patient had an injury, nakalateral decube, nakatagilid, pero ang cassette dito nakalagay, no? Between the thorax, no? Between the thorax and the arm, nakapatong dyan ang cassette, nakatagilid ang pasyente. So anong dine-demonstrate? To demonstrate the lesser tubercle in profile. I repeat, lesser tubercle in profile can be demonstrated when the patient is in lateral decubitus to demonstrate the humerus. So madidiscuss natin, mapuposition ko ng maayos during our face-to-face discussion. Next question, which description best explains how radial crossover occurs when the forearm is demonstrated? Which description best explain how radial crossover occurs when the forearm is demonstrated? So in other words, sa forearm, ano lang ang projections natin sa forearm? We have only two routine projections, di ba? Isang AP projection at isang AP projection at isang lateral projection. Sir, answer po ng item 84, panako, si ano hindi nakikinig joke lang. Sino hindi nakikinig dyan? Busy siguro. Lepitin, hindi ka nakikinig. Paling kita dyan 84, anong sagot sa 84? Ayan, sagot sa 84, letter C, lesser tubercle in profile. Ayan, 85, I repeat, which description best explains? Ayan, sabi ko nga kanina, mayroon tayong dalawang projections, routine projections, demonstrating the forearm. So sabi nga natin, dalawang bones din ang consist of the forearm. We have the radius and the ulna. Diba? So the ulna is located medially and the radius is located laterally based on the anatomical position. Diba? So based on the anatomical position, the ulna is located medially and the radius is located laterally. Yan. So sa forearm, dalawang projections. We have the AP and the lateral projection. So ano ang sagot natin dito? Na ang radial crossover occurs when the forearm is in PA. AP projection, but the hand isn't pronated. The hand is in pronation. AP projection, but the hand is in pronation. Yan. So in other words, the distal or rather the distal end of the forearm cross over. No? The distal end of the radius cross over the ulna. Yan. So naka-cross over yon kung naka-AP projection but the hand is in pronation. Dahil ang normal, ang walang close crossover, ang proximal end of the radius over the ulna when the hand is in supination. Yan. Okay. Number 85, alpha is the answer. Number 86, when performing a radiograph of forearm in a fiberglass cast, approximately which compensation to exposure technique should occur? Yan, compensation, approximately which compensation to exposure technique should occur? Diba pag nag-e-x-ray tayo, yan, especially sa forearm, kung merong fracture or in other area, it's either na ginagamitan ng fiberglass na cast or it's either ginagamitan natin ng small cast, yung basa, di ba? Sinisemento, pwedeng basa or natuyo na and fiberglass. So magkakaiba ang factor nila. Yan, so pag fiberglass cast, ano ang factor? Yan, increase the MAS by 25%. So pag in-increase mo ang MAS ng 25%, hindi mo na i-increase ang KVP. Diba? Kung retain mo ang MAS and you want to increase the kVp, ilang kVp? 4 kilovoltage peak ang itataas natin, no? So either of the two. Hindi mo pwedeng i-increase pareho, pero pwede naman. No? Pag nag-extray tayo, wala namang nakikialam doon. So pwede tayo mag-increase ng MAS, pwede tayo mag-increase ng kVp. Pero in discussions for board examination purposes, yan, we have to increase. If we increase the MAS, we increase by 25% for fiberglass casts. Or kung mag-i-increase tayo ng kVp, 4 kVp ang i-increase natin. Either of the two, pwede. So ito yung mga factors natin. No? So for fiberglass, increase the mass by 25 to 30% ang increase. Or so kung kVp naman ang itataas natin, 3 to 4 kV ang itataas natin. Okay? Wait lang ha, may titingnan lang ako na image. Sorry naman. Ako lang. O kasi nga alis. No problem. Yan, small to medium plaster casts. Pag small to medium plaster cast, ilan ang i-increase natin na MAS? 50 to 60%. Pag MAS, pag kVp, ilan ang itataas natin? 5 to 7 kV. Yan, pag large ang plaster cast, increase the MAS by 100%. Yan, dodoblehin ang MAS or magtataas tayo ng kVp ng 8 to 10 kV. So yan, ito yung mga fiberglass, no? Fiberglass ng small to medium plaster cast, large plaster cast, or kung mayroong dry cast and wet cast, yan, madidiscuss yon doon sa image production and evaluation. Yan, madidiscuss yan. Okay, next question. Which of the following is best for demonstration of a foreign body in the hand? Yan. Kung i-demonstrate natin, meron tayong routine projection to demonstrate the foreign body of the hand. Normally, ano ang routine natin sa hand for the demonstration of the foreign body? We have only a PA and lateral. Diba? PA and lateral. Yan ang normal natin na routine projections. Pero common questions, like for example, this one. Kung ang i-demonstrate natin ay foreign body of the hand, what is the answer? The hand should be in extended lateral. Yan, lateral in extension. Yan, ang fan knife lateral, ano ang dine-demonstrate natin dito? The individual phalanges. When there is a fracture in the individual phalanges. Yan. Almost all individual phalanges can be demonstrated here in fan knife lateral. So yan ang dalawang lateral natin, no? We have the lateral in extension. If we are going to demonstrate the foreign body of the hand, ayan, for fan knife lateral, hindi yan para doon sa foreign body. Para saan yan? Fractures of the individual phalanges. Doon yan dine-demonstrate. Ayan. Wait lang ha. And yung hand APL routine ng foot. Yan. O, tama yun, Aldrin. Pag foot, APL. Pag hand, yan. PA and lateral. Diba? Hand, PA and lateral. Tama. Yan. Okay. So next, which evaluation criterion pertains to the PAH or HAAS method of the skull? Ano nga ang opposite ng HAAS sa skull? We have the Townes method, di ba? Townes method, that is the opposite of HAAS method. So, PAH sa Townes sa HAAS method, that is the opposite also of APH of the skull. Yan. So, ano ang evaluation criteria in the PAH or HAAS method of the skull? Is that the dorsum sella and the posterior clinoid process is projected within the foramen magnum. No? So, ang dorsum sella and the posterior clinoid process is or are projected within the foramen magnum in HAAS method or in the PAHL projection of the skull. So tandaan, pag sinabi natin PAHL projection of the skull, that is referring to HAAS method. Okay? So the other criterion, aside for the dorsum sella and the posterior clinoid process, are projected within the foramen magnum. The other criteria is that the petrous pyramid is symmetrical. And the hypersthenic and obese patient, and the central ray for the HAAS method is 25 degrees to the OML. So ang central ray natin ng HAAS method ay 25 degrees to the OML. So in other words, the X-ray beam enters in the external occipital protuberance. Doon papasok ang X-ray beam. So these are the criteria for the PAHL projection or for the HAAS method of the skull. The dorsum sella and the posterior clinoid process are located within the foramen magnum. The petrous pyramid is symmetric in position, and this is also the hypersthenic and obese patient, and the central ray is 25 degrees to the OML for the HAAS. So ang HAAS method is applicable also, I repeat, for when the patient is hypersthenic or obese patient. Which positioning line should be parallel to the image receptor for the SMV projection of the skull? So lagi nating tatandaan, pag sinabing submento vertical possession, walang ibang line ang pinag-uusapan natin dyan. The infraorbitomeatal line. So the IPL, or rather the infraorbito IOML, the infraorbitomeatal line is always parallel in the submento vertical projection of the skull. Walang ibang line lagi dyan kung hindi infraorbitomeatal line. Pag sinabi nating infraorbitomeatal line, that is a line that connects between the inferior border of the orbit, inferior border of the orbit to the center of the external auditory meatus. So pag sinabi natin IOML, that is the line that connects from the inferior border of the orbit to the center of the external auditory meatus. Ano naman class ang tawag doon sa line that connects from the inferior border of the orbit to the superior margin of the external auditory meatus? Ano ang tawag? Sige, may Gcash sa akin. O anong tawag sa line na yon? A line
Again
that
po?
A line, ba't yung galit? De, joke lang. Wait lang.
Hindi
A line that connects from the inferior margin of the orbit to the superior margin of the external auditory meatus. Wait lang ha, tingnan ko. Anong tawag sa line na yon?
IPL. IPL.
Mali, hindi. 100 Gcash.
infraorbitomeatal line po.
IOML.
IOML po.
IOML.
Wait lang, makinig. Sabi ko pala, ako pala yung nag-lecture. So, ang sinabi nating IOML, infraorbitomeatal line, a line. Listen, a line that connects from the inferior margin of the orbit to the center of the external auditory meatus. Inferior margin of the orbit to the center of the external auditory meatus. IOML yon. Infraorbitomeatal line. Ang tanong ko, what do you call the line that connects from the inferior margin of the orbit to the superior margin of the external auditory meatus? Ano ang tawag doon na yun? Yan, ang bilis. Yan, mamaya na, Rika. Tama yon. That is Frankfurt line. Frankfurt. Yung Frankfurt na yon, Rika, FU yun, ha? Yung spelling. Frankfurt baseline. Ano ang number ng Gcash? Rika, Rodrigo? Rika, mamaya isend mo. Ha? I-send mo sa messenger ng equip. Yan, para mayroong 100 Gcash. One more question. Wala na, ano ka, mag-ready kayo. Mas maganda yung hindi ready. No? O, Rika, send mo yung ano ha, yung Gcash number mo. Gcash, sabi ko ba Gcash number yan? Gcash number sa messenger ng equip. Yan, para mapadalhan kita. Okay, next. So, ang sagot natin dito, that is infra-orbitomeatal line sa number 89. Yan, infra-orbitomeatal line. Next number, number 90. Yan, number 90. With reference to the image receptor, how should the interpapillary line and the mid-sagittal plane be positioned for the lateral projection of the skull? Yan. So sa lateral projection of the skull, ano daw ang position ng interpapillary line and mid-sagittal plane? Diba? So laging tatandaan, kung ang pasyente ay ang skull niya ay lateral, always remember that the IPL is perpendicular and the mid-sagittal plane of the head is always parallel in relation to the image receptor. So lagi yon. Kung ang skull ay nakalateral, ibig sabihin ang IPL ay laging perpendicular and mid-sagittal plane is always parallel kung nakalateral ang skull natin. Kung nakalateral ang skull. Laging tatandaan pag sinabi nating IPL, interpapillary line. Ano nga ang other term ng IPL? IPL. Anong other term? Sige nga. 100 ulit, Gcash. 100 ulit. IPL, madadali lang yan, ha? Yes, Hermitanyo. Gcash, yun nga. What is the other name for the interpapillary line? 1, 2, 3, 4, 5. Tapos na. Wala na. Ang sakal sumagot eh. Platal line. Platal line? Ano yun? Parang ngayon ko lang ito na alam Platal line. Number, pabalik sa 89. Ano sagot? What is the other term for interpapillary line? So the other term for interpapillary line, that is interorbital line. Interpapillary line or interorbital line, that is a line that connects between two pupils. So a line that connects between two pupils, that is interpapillary line. Yan. Okay, next. Number 89, sagot, infraorbitomeatal line. Next number, in which projection of the sinuses must the OML form an angle of 15 degrees with the plane of the film or with the plane of the image receptor? So alin dito ang projection ng sinuses na ang central ray ay 15 degrees angle in relation or with the plane of the film? So that is Caldwell method. So Caldwell method or PAH projection, that is the method or the projection demonstrating the frontal sinuses. So the best projection demonstrating the frontal sinuses, that is PAH. The best method demonstrating the frontal sinuses, that is Caldwell method. So in the Caldwell method, the central ray is 15 degrees caudally, and in the Caldwell method, the Petros pyramid or the Petros ridges is located in the lower third of the orbit. Pag once na ang central ray ay naka-angle ng 15 degrees in the Caldwell method, saan makikita ang Petros ridges? Petros ridges can be seen in the lower third of the orbit. Lower third of the orbit, doon makikita ang Petros ridges kung naka 15 degrees angle ka. Or in the Caldwell method. So that is the lateral projection of the skull in the left upper portion of your monitor. Yan, that is the lateral projection of the skull. Dito naman sa lower portion, that is the submento vertical position. Dito naman sa right upper portion, that is the Caldwell method. So the Caldwell method, that is where the forehead and the nose are touching the tabletop. The forehead and the nose are touching the tabletop. At dito naman sa lower right portion, that is the Waters method. Waters method, that is where the chin and touching the tabletop. So laging tatandaan, pag sinuses ang ine-x-ray natin, the patient is always in upright position. Laging naka-upright ang pasyente kung sinuses or paranasal sinuses ang dinedemonstrate natin. Bakit upright? Dahil baka mayroong air level or mayroong fluid level or other pathologic conditions that affects the accessory nasal cavities. Yan. That can be demonstrated. Upright lagi yon. Okay, next question. Which of the following study requires a comparative radiographic study with the mouth open and closed respectively? So in other words, ano ang comparative radiographic study wherein the mouth is open and closed? So meron tayong procedure doon sa skull, meron tayong procedures that is where we are going to perform two exposure at the same time. Dalawang projections. Isang projection wherein the mouth is open and isang projection wherein the mouth is closed, and that is temporomandibular joint. So temporomandibular joint. So ang hypoglossal canal, anong method yan? Ang ginagamit natin, that is Miller method. Miller method, that is for the demonstration of the hypoglossal canal. So for the mastoid, ano ang dine-demonstrate? For the mastoid, anong projections tayo? Townes method, we have the Schuler method, and we have the Lowe method for the demonstration of the mastoid. And according to the board of RADTECH, the best projection demonstrating the zygomatic arches, that is SMV. Diba? So the best projection demonstrating the zygomatic arches, that is SMV. Yan. So ito yung projections natin, for the demonstration of the temporomandibular joint. Isang projection wherein the mouth is closed and the other one wherein the mouth is open. Next question, we have what should be done if the patient is unable to extend his or her head sufficiently for the acanthoparietal projection. Pag sinabi natin acanthoparietal projection, that is also known as reverse Waters method. Normally, gumagawa lang tayo ng reverse Waters method kung during vehicular accidents or when the patient is unable not to perform the Waters method. So ano ang what is the best method? Done? What should be done if unable to extend her head? Yan. So the answer, we have to place a support behind the patient's shoulders para maiangat, and we have to angle the tube cephalad. Yan. Ano ang baseline natin, class, dito sa reverse Waters method? Our baseline for the reverse Waters is MML. So pag sinabi nating MML, that is mento-meatal line. Mento-meatal line, that is the baseline for the Waters method. Either Waters or reverse Waters. Yan, pag sinabi nating MML, pag sinabi nating baseline, class, kung mayroong tanong sa board exam na baseline, in other words, yan ang line na hindi naka-angle. That is the line which is perpendicular to the image receptor. So dito sa Waters, ang mento-meatal line is perpendicular to the image receptor. Pag sinabi nating MML, that is a line that connects from the mentum to a line that connects from the mentum to the center of the external auditory meatus, that is MML. And these reverse waters, this is also used to demonstrate the superior facial bones. So to demonstrate better of the superior facial bones, this can be performed in a reverse waters method. So sa reverse waters, saan makikita ang petrous ridges? The petrous ridges can be projected below the maxillary sinuses. So in reverse waters method, saan makikita ang petrous ridges? The petrous ridges is projected below the maxillary sinuses. So for the number 18, yeah, the answer is 1 and 2. So that is the acanthio parietal. Ito yung sinasabi natin, class, that the MML is perpendicular to the tabletop. Yung may line na yan, no? Yung puti na yan, that is the MML. That is a line that connects from the mentum or from the symphysis menti to the center of the external auditory meatus. So ang central ray, ang reference point natin sa reverse waters, that is acanthion. Acanthion, that is the reference point for the reverse waters. Yeah, that is the possessor. Okay, next, next number. Which of the following will best demonstrate the acromioclavicular separation? So for the demonstration, so saan natin makikita ang acromioclavicular joint? In the lateral end of the clavicle. So the joint or the articulations which is located, which is located in the lateral end of the clavicle, that is acromioclavicular joint. So ano ang nagde-demonstrate ng acromioclavicular joint kung mayroon bang separation o wala? The answer is the AP erect of both shoulders. AP erect for both shoulders. Ano ang tawag natin dyan? Sa acromioclavicular, bilateral yan, ha? AP erect, bilateral, or AP erect, both shoulders. Yan, dalawang exposures ang ginagawa natin dito. Kung mayroon bang shoulder separation, kung mayroon bang dislocation or subluxation of the acromioclavicular joint. So pag bilateral, yan, dine-demonstrate natin and right and left acromioclavicular joint. Yan. So dalawang exposure, isang exposure na with weights at isang exposure na without weight. Yan. So sa 14/17 crosswise, 14/17 crosswise, yan, dalawang exposures yan. Isang exposure na with weights at isang exposure na without weights. No, that is AP projection bilateral. No, stress method ang tawag natin dito. Stress method. Okay, next number. Blowout fractures of the orbit are best demonstrated using what projection? Yeah, blowout fracture. So the answer here, we have parieto-acanthial or Waters method. So blowout fracture can be demonstrated in modified Waters method. Modified Waters. So normally ang Waters natin, ilang degrees nga ang OML sa Waters in relation to the tabletop? That is 37 degrees, di ba? Ang normal Waters method natin, that is 37 degrees ang angle ng OML. So for the demonstration of the blowout fractures, saan makikita ang blowout fractures? In the floor of the orbit. Blowout fracture can be seen in the floor of the orbit. At ano ang nagde-demonstrate ng blowout fracture? That is modified Waters method. So ilang degrees? Pag modified Waters, ilang degrees ang OML? 55 degrees ang OML in relation to the tabletop. No, 55. Wait lang ha, titingnan ko lang. Yan, 55. Yan, modified water. Yan, tama yon. Sino ito? Pops, Nola. Yan, tama yan, Chari. So, ang stress method or for the demonstration of the bilateral stress method or the Pearson method. No? Pag Pearson method, bilateral. Pag isa lang, anong method ang ginagamit? Pag isa lang na acromioclavicular joint. Pag acromio, yan, Alexander method. for the unilateral of the acromioclavicular joint. Unilateral, isang acromioclavicular joint lang. Alexander method naman ang method na ginagamit natin. So pag bilateral ng acromioclavicular joint, Pearson method, or that is also known as stress method. Yan, balik tayo sa blowout fractures. No? Ang blowout fractures, that is the fracture which can be seen in the floor of the orbit. At ang nagde-demonstrate niyan ay modified waters. Modified waters. Pag waters method, ano ang other term? That is parieto-acanthial. Parieto-acanthial, or ano pang other term ng waters method?
Mahoney's method, sir.
Mahoney's method. Mahoney's method, parieto-acanthial, or waters method. Or, ano pang isa? Ano yan? Parieto-acanthial, Mahoney's method, waters method, and ano pa yung isa? Sige nga. GCash ulit. Ilan na ba ipapadalhan ko ng GCash? Isa pa lang, no? Isa pa lang yung papadalhan ko ng GCash. 100, sayang din yun. Pambili ng soft drinks. Another 100 GCash. Dito. Other name, parieto-acanthial, Mahoney's method, waters method. 1, 2, 3, 4, 5.
Occipitomental.
Ayun, no? Anong weteng yan? Yan, Miss Tagaro. Tagaro. J. Angelo. Mamaya, na? Occipitomental, na? Parieto-acanthial, waters, Mahoney's method, and occipitomental. Bakit tinawag na occipitomental? Because the X-ray beam enters in the occipital area or in the occiput and exit in the mental or symphysis menti. Kaya tinawag na occipitomental. Okay, next question. Yan, ito na dito pala yung mga discussions ko. Ano ba yan? Next. In order to better demonstrate the mandibular rami in the PA possession, in other words, the central ray should be angled cephalad or towards the head. Ilang degrees? To demonstrate the mandibular rami in PA possession, the central ray should be angled 30 degrees cephalad. 30 degrees cephalad for the PA possession, for the demonstration of the mandibular rami. Lateral deviation of the nasal septum may be best demonstrated in what projection? Lateral deviation of the nasal septum may be demonstrated in Waters' method or in parieto-acanthial. No, dito sa atin, sa bansa nyo, sa bansa natin, yan, ang routine lang natin for the demonstration of the nasal bones ay lateral lang, no? Both lateral, right and left lateral. Ano kaya pinag-iba noon? Parehas lang naman, di ba? Pag right and left lateral sa nasal bones, makikita mo kung mayroong depression ba? O makikita mo yung fracture. Is it the fracture of the nasal bones is nakalabas, di ba? O kaya papaloob, no? Sa lateral makikita yon. So sa Waters, doon mo makikita ang kung mayroon bang lateral or medial deviation of the nasal septum. So that can be demonstrated in Waters. Pero bihira tayo dito sa Pilipinas na nag-X-ray sa nasal bone fracture. Diba, no? Nang mayroong Waters dahil lateral lang. Yun lang ang routine natin. Pero the normal routine for the demonstration when there is a lateral or medial deviation of the nasal septum, ang routine natin dyan, that is Waters and lateral. Pero specifically, for the lateral or medial division of the nasal septum, Waters method yan. When the patient is unable to assume the upright body possession, how should a lateral projection of the sinuses be obtained? Diba sabi nga natin, sinuses tayo. O kung mapunta man tayo sa body, sa lungs, diba pag hindi kaya ng pasyente ng upright possession to demonstrate the fluid level, or the air level, we should take the lateral decubitus. Diba? Yan. So dito naman, sa sinuses, hindi kaya ng pasyente ng naka-upright, how should the lateral projection be obtained? It can be obtained horizontal beam lateral. No? Supine ang pasyente, meron ba dito? Wala. Nakasupine ang pasyente and the cassette must be placed on the head side of the patient, then horizontally directed. So that is horizontal beam lateral for the demonstration whether there is an air level or when there is a fluid level. To demonstrate the entire circumference of the radial head exposure must be made with the, yan, pag radial head or the entire circumference of radial head. Ito yung ginagamitan natin class na 4 exposures. No? The entire, to demonstrate the entire circumference of the radial head, yan ang mayroong 4 na exposures. So ang sagot natin dito muna, epicondyles perpendicular, the hand pronated and supinated as possible, and the hand in lateral and in internal rotation. Ito yon. So this is for the demonstration of the entire circumference of the radial head. So 4 exposure factors or 4 exposure positions. Isang unang exposure wherein the hand is in external rotation. External rotation yan. The second, yung the right upper portion, that is where the hand is in extended position. Yan, lateral. And the third exposure wherein the hand is in pronation. And the last exposure wherein the hand is in internal rotation. Yan. So that is for the demonstration of the entire circumference of the radial head. 4 exposures be made. Okay? With the patient's head in a PA position and the central ray is directed 20 degrees cephalad, which 20 degrees cephalad, which part of the mandible will be best visualized? So kung naka-PA position and the central ray is 20 degrees cephalad, which part of the mandible should be visualized? So the body is the one being visualized. That is the part of the mandible that can be visualized or that can be demonstrated in the PA position wherein the central ray is 20 degrees cephalad. Okay, so the answer is Charlie. So that is the end of our lecture or discussions. Do you have any questions? Any questions, class? Okay, so reminders ha. Baka magtanong na naman ng video recorded. Ang video recording natin, uulitin ko ulit at the end of the dynamic online review. So pagkatapos pa ng dynamic online, in other words, kahit na nasa face-to-face tayo, kung gusto nyong mag-access dito sa recorded video natin ng mga lecture or discussions, then makaka-access kayo anytime later on. So sa kanyo na muna problemahin yun. Ang poproblemahin nyo na muna, ano ba ang next subject sa Saturday and Sunday? Para doon din kayo muna nakafocus. Okay? Yung recorded video, later on pa yun. Merong tayong time kung kailan kayo pwedeng mag-access doon sa recorded video at the end of the review. Probably after the first pre-board exam. Kasi may pre-board exam tayo dito, class. Mayroon tayong pre-board exam dito sa phase 1 natin sa dynamic. At mayroon din tayong pre-board exam doon sa face-to-face. Kaya lang dito sa dynamic, ang pre-board exam natin, that is online pa din. Okay, any questions? Class, any questions? Wait lang, basahin ko lang ha. Rani, may napansin lang po ako pag-exam. Wait lang ha. Pag axial projections, pag PA po parate, kaudad. Then pag AP parate si. Yan, majority. Most of the time, Rani. Ha? Most of the time. Most of the projections, yan. Pag axial, pag PA, yan, kaudad ang angulation. Natataon lang siguro pero not all the time. Ha? Yan. Yung rotation po ba ng tube below, rotation ng tube below 10 degrees, tangential po ba tawag doon, sir? Hindi. Okay, ganito. Yan, Abu Bakar, Amerol. Ang pinag-iba natin doon sa tangential at axial, pag axial, tubo ang naka-angle ng 10 degrees or more. Ibig sabihin, kung ang angulation ay 5 or 7 degrees, hindi tayo gagamit ng axial na word. Wala lang. Diba? So gagamit lang tayo ng axial na word kung ang angulation ay 10 degrees or more. Ang tangential naman, kailan natin ginagamit ang tangential? Kung ang body part ang ina-angle natin. Walang kinalaman ng tubo. Body part. No? So kung ang body part ang ina-angle natin, tangential ang tawag doon. Pero kung axial, 10 degrees, tubo ang pinag-uusapan, not part. Tubo na mayroong 10 degrees above. Kung ang angulation mo ay 8 degrees, 9 degrees, hindi pa axial yun. Okay? Yan. Any questions? Nagsimba na ba kayo? Ano na kayo? Wala pa? Yan. So, yan. Since na Sunday,
Tapos po, sir.
yan. Instead na Sunday, and that is our obligation. Yeah? That is our obligation. And obligation yun ng bawat tao, no? To pray. So for Christians, obligation natin is to visit the church. Diba? Yan. Okay, thank you very much. And until next week. No? O yung hindi pa nag-submit, huwag kayong mandaya sa sagot. Baka hindi pa kayo nako kayo. Yan. Sige, thank you very much. God
Thank you,
bless
sir.
everyone.
Happy Sunday.
Happy
Thank you,
Sunday.
Thank you,
Thank you, sir.
Thank you.
Bless,
God
sir.
bless. God
Thank
bless
you,
everyone.
sir.
Thank you, sir.
Thank you.
Thank you po, sir.
Salamat.
Thank you, sir.
Nandito ba si Cervantes? Darwin? Darwin. Cervantes, are you present? Darwin Cervantes, please raise your hand to be acknowledged. Wala? Absent ka na naman, Darwin? Wala ka talagang buhay. Etos, joke lang.
Thank you po, sir.
Thank you.
Recording stopped.